Welcome to episode 14 of D-1 All-Stars. This is Alder Joe Maldonado. I am here today with a special guest, Dr. Wendy Molaska. She's going to be talking to us about all things under the sun, but I just got to know her earlier this year, and I'm really excited to dig deep into her practice and her structure on medicine. It was a really exciting conversation we had back in the beginning of this year, and I'm excited to continue that. So welcome, Dr. Molaska.
Thank you very much. I'm really excited to be here. I love talking about all things medicine and everything else. And I was, really pleased when you stopped by our door and introduced yourself as our new Alder. And then, we just continued talking from there.
Absolutely. Now, the fun part about this redistricting thing that we do every 10 years is I got a whole new set of constituents, and actually your area was where I started knocking doors first because I wanted to get to know new folks, and you ended up writing back to me. I was so excited to see that, one, like, folks were really like plugged in and paying attention, and then two, we just got into a whole really interesting conversation, which we'll get into. So the way that I structure this is first I start, asking folks about who they are. So tell me your superhero origin story.
Ooh, do I need to strike a superhero pose when I do it?
Absolutely, that's mandatory.
Okay. So my superhero story, I started as a very sick kid who was in and out of the hospital a lot. And so I decided back when I was about 5 years old that I was going to be a doctor. And I never wavered from that course. So I grew up in Wausau, Wisconsin, and then went to undergrad and medical school in Madison and got my medical degree. Went to family practice residency because I decided family medicine was the place I wanted to be because I got to do everything. It's what I call womb to tomb medicine. I get to deliver babies and do everything in between, all the way up to hospice and end of life care. So it really appealed to me that I get to know families and patients over time. So I did my family practice residency in North Minneapolis before joining the National Health Service Corps, and was placed out in rural Colorado doing family medicine. A couple of the things that have always interested me. So North Minneapolis was a very underserved area. The rural Colorado area was underserved area. So I've always had this interest in kind of underserved healthcare for those people who are uninsured, underinsured, otherwise unable to access healthcare. And so this has kind of been the driving force behind my entire career. I eventually came back to Wisconsin. Worked out in Platteville, another rural area here in Wisconsin, for many years before I met a guy, got married, and had a kid. And when you have a kid, you can't really split time between Madison and Platteville. So we moved to Madison, easier for my husband to keep his job here and me to get a new job. So I took a job in Madison for a while. And we had a couple of kids, and I found myself in burning out in medicine, which was just tragic to me. Partially because this is the only thing I've ever imagined myself doing, is being a physician. And now I didn't feel like I was getting to be the physician I wanted to be. There's all this pressure from insurance and administrators and prior authorizations and formularies and all this kind of stuff, where it felt like there were so many people in between myself and what I was doing, that I wasn't actually having that doctor-patient relationship. I'd get, 15 minutes with patients, and then my patients were telling me, "Hey, doc, it takes 3 months to get an appointment with you," or "I got to see whoever's available." And that's just not good medicine either, because, like I said, I want to get to know my patients and be able to, serve them when they need it. The other interesting thing is, as I mentioned, I was a really sick kid. And so I was born with something called Marfan syndrome, which is a connective tissue disorder. And one of the main problems is a weakened aorta, the main artery that comes off the heart. So in 2006, I had open heart surgery to replace my aorta. And after the surgery, I can read through all of the bills and the coding and stuff. And there were several mistakes in there that I ended up fighting with insurance for a year to get cleared up. And it started to, come to me that I'm like, I'm able to do this because I can read through these with a fine-tooth comb and know what I'm reading. and during this year, I've been threatened to be sent to collections and everything else. And I'm like, no, because this is incorrect and I'm going to fight this. But how does a layperson do this who doesn't have that coding experience and that background and the medical knowledge and stuff to read through these? And I'm like, people are just paying bills that are probably not accurate. So there's a couple of different things, both from the physician standpoint and then the patient standpoint, where I was like, our healthcare system is not really functioning the way it actually should be. And so in December 2020, I left my employed position as a physician, and then December of 2020, yes, because then in May of 2021, so just over a year ago, I opened my direct primary care clinic here in Fitchburg. And I think, yep. And so I think we'll talk about this a little bit later, but yeah, basically I decided I need a whole new way to provide medical care for people. And that's where I'm at.
Wow. So that's fascinating. I want to start at the beginning though, because, you said being sick, it ultimately led you to do what you want to do. But, having worked in advising with, undergraduates, oftentimes like everybody wants to be a doctor, right? And there's usually sort of a narrowing down, either through rigorous coursework or just through the stress, physically, mentally, emotionally that comes with medical school. To get there. So sort of what kept you in the game, what kept you going through that whole process to be able to get to the point of, becoming a physician?
So I think part of it is, again, just continuing to have that contact. So nobody in my family was necessarily medical. And I think that's also a hard place to come from if you're a student trying to become a physician, is that if you don't have that background of what it is to go through medical school and residency and stuff, I think that can be intimidating for a lot of people. So I didn't have that background, but again, with Marfan syndrome, I'm constantly seeing doctors in and out of hospitals. I've had multiple different complications from this. So I was always, as a patient, part of the system. And I had really good doctors and really bad doctors throughout my younger years. And so one of the ones that my mom remembers from when I was 5 was a surgeon that I had who had no bedside manner. And I'm a little kid and I'm scared and I'm in the hospital and in pain and stuff. And he was like, oh yeah, whatever, this isn't going to hurt. And it hurts. And so I told him, when I grow up, I'm going to take your job. And so I decided
what did he say?
He just ignored me because, whatever. But yeah, I was just set on being a physician, and I did not end up being a surgeon and taking his job. But I think part of it was, just, that real drive to know, hey, I had really good doctors who this is what I want to emulate. And then there are these other physicians out here who I'm like, yeah, we need to replace them. So, and I think there were other programs in place when I was doing this as well. So there was what was called the Medical Scholars Program. So as a graduating high school student, I was valedictorian of my class. I actually applied to the Medical Scholars Program, which gave me conditional admittance to medical school from high school. So when I came down here to Madison, I had to take certain undergrad courses, maintain a certain GPA, but I didn't actually have to then apply to medical school. I was already admitted so long as I met those requirements throughout undergrad. And that was really kind of a nice program because then I already knew I was going to medical school. I didn't have to worry as much, I don't think, about, making sure that my letters of recommendation and my, college courses and everything were, quite as, I just didn't need to do, I feel like, as much stuff as students these days need to do to be able to prove themselves, because there's so many smart students out there. But yeah, you have to, what's going to make you stand out on medical school applications. So
you had lived experience, support, and also the understanding of not, having had other family members go through it. So that's sort of the things that push you through. This is incredibly interesting. I'm looking forward to keeping the train going, but we're going to be back after a break. We're here with Dr. Wendy Molaska. When we get back, we'll talk a little bit about how you got over here to Fitchburg.